Hi, today's video is on OET reading and I'm going to focus on part B of reading. In this video, I'll start off with what we have in OET reading part B, why do we have a section as part B in reading and its relevance, and I will also share the tips that hopefully will be helpful in solving part B of reading. So let's get started with the video. Now, reading part B. We know in reading there are three different sections, A, B and C. Part B and C together will last for 45 minutes. In part B of reading, you have to solve 6 questions and each of these will be 3 option multiple choice questions. So you have options A, B and C given and you have to choose one right answer. You will be reading certain extracts and based on these extracts, you're going to solve these questions. Now, part B is very different from part A and the type of text you will be reading in part B is again different from that of part C. Though you will realize that B and C has a similar question format, which is multiple choice questions, in part B, you will be given only 3 answer options and you have to choose one right answer. So what are the different types of texts you will be reading or extracts you will be reading in part B of reading? Let's find out. The first is emails. Now we know emails is something you will come across in your work setting. So as a professional healthcare practitioner, you will be getting a lot of emails as a part of your workplace communication. Probably emails updating you regarding policies. It could be something newly introduced in your hospital, things you should do, things you shouldn't do, and so on. The next possible type of extract are memos. Now, memos are sent either to the entire staff or to a particular section of the staff. For instance, a memo could be sent to staff taking up night duty, probably to inform or update regarding certain practices that you need to keep in mind while taking up your night shift. Next is guidelines. So normally a guideline is a very long extract. You might have pages and pages of information on that. But you're not going to read that huge list of pages there. You will be exposed to only a part of the guideline. It could be recruitment guidelines, it could be joining guidelines, it could be any procedure regarding patient care. Another type of extract are the policy documents. Again, these documents are long extracts, but you will be given only a part of it and referring to that small section, you have to solve the questions. So 1, 2, 3, 4 emails, memos, guidelines and policy documents are the different types of resources used in your part B of reading. Now the next very popular question, why do we have a part B in OET reading? How is it relevant to what you will be experiencing when you start working in an English speaking country? Well, the relevance is it focuses on testing your understanding, how much you understand workplace communication. Now, all of these different extract types or sources that are listed here fall in this category of workplace communication. So, are you able to understand details given in the workplace communication? You may need to identify the purpose. Okay, this is one aspect that is being tested. You may need to identify the overall idea, or it could be the gist of the document, or you may need to look up for something specific. For instance, what is that one thing you need to keep in mind when you discharge a patient? So something very specific. So this is what is being tested in part B of OET reading, and it has great relevance to your professional lives, because as a working nurse, as a working doctor, as a working healthcare practitioner, on a daily basis, you will come across all of these types of extracts. Emails, not just one, probably you'll be bombarded with a lot of emails. So, are you able to read those lengthy texts and understand what is relevant to you? And if you're able to understand what is relevant to you, how will you put it into practice? This is what is being tested in OET Reading Part B. Now that you've understood the type of extracts you will be reading and the relevance of the section, let's solve a couple of questions, and as we solve, I'm going to introduce you to the techniques. So let's get started with that. First, let's understand the format of the question. This is what we were talking about, the extract. So here it says extract from a manual on surgery, and the section is disclosure. So we know that a manual, now manual is a book that tells you how to do things. So a manual on surgery will be a thick document. Now the extract is taken from that manual, and as you can see, there are just a few lines here, maybe in total 8 or 10 lines, that's it. So a small section of the manual on surgery is taken here. You're going to refer this. So you're going to refer this bit of extract and you have to answer this question given. Here, there are two types of questions possible in OET Reading Part B. One is this particular type, where it says when disclosing distressing information to patients, comma, staff must avoid ... which means one of the answer options listed here will basically complete the sentence. So this is one way in which questions are asked, a sentence completion question type. Now all these three answer options, A, B and C, will be grammatically correct, which means you cannot just check if it fits grammatically and find the answer. You have to refer to the extract to be able to understand the answer. Okay? So this is one type, sentence completion. The second type that you will also see as we discuss another question today is a short answer question type. Now what do I mean by short answer question type? Simply that it will be a complete question. For instance, how many rounds should be taken by the doctor before the patient is discharged? Question mark. Okay, so the option will be a short answer to that question. So there are two types or two ways in which questions can happen in Part B of reading. Okay, so let's look at this extract in more detail. So step 1 will be focus on the question. The question has a stem here. Okay, so the stem is basically the question. You also have the options. Now underline the keywords in the stem. So let's read the stem. When disclosing distressing information. When disclosing distressing information, to whom? To patients. Why? It means we don't have to focus on family members, bystanders, relatives. We focus on disclosing information to patients. And what kind of information? Distressing information. Okay, things that are not pleasant, sad, maybe about death, maybe about a terminal illness. Okay, staff must avoid. Must, that means it is not optional. This is something they have to abide by. Now who? We're talking about the staff. So the doctor, the nurse, or basically the healthcare practitioner will have to strictly adhere to, abide by, must avoid. So this is a key word there, must, because there might be other options given in the extract, but we focus only on that part which is mandatory for a healthcare practitioner to follow. So what are the options given? Let's look at the options as well and underline the keyword. So option A says temptation to use simplistic language. Temptation to use simplistic language. B. Directing their attention at family members. That means focusing on the family members. This is something they shouldn't do. So must avoid, right? Must avoid not to use simple language, not to direct attention at family members. Option 3, any approach leads to misunderstanding. Not to do anything which will lead to misunderstanding. Okay? Avoid approaches leading to misunderstanding. Now that we've understood this part, let's look at the extract also. So what are the keywords we've underlined? Disclosing distressing information, must avoid, it's of course only to patients. Temptation to use simplistic language, directing their attention at family members, or approach which leads to misunderstanding. Do not, must avoid, do not. Okay, now let's look at the extract. Delivery of bad news is very difficult. Talk to patient in the company of family, preferably away from other patients. Some cultures, not common, give difficult news directly to patient. Must be aware, must what? Of the norms and customs of our patient. May not match our own. Okay, so this is just for your information. Must be aware, customs are different. Often try to soften the delivery of bad news by saying too much and confusing the matter. Okay, saying too much and confusing the matter, or by saying too little and leaving people with unanswered questions. Okay, so it says simplistic language, but it says we soften the delivery of bad news by saying too much. Okay, so it's not simple, we make it confusing. So, and even though we say very little, it does not anywhere convey to the language we use. We say little, but the language we may use, it's not clearly mentioned whether it is simple or whether it is complex. So we can eliminate option A. Don't say, don't, very strictly, don't say neoplasm if what you mean and will be understood is cancer. Be clear, allow people to understand and feel some of the impact. Okay, what will be understood is cancer, do not say neoplasm. So, misunderstanding. Misunderstanding to be avoided. Misunderstanding to be avoided, option C. Now, directing attention at family members, it says you have to speak in the company of family members, but it doesn't say you have to focus on family members. So, there is a mention of family members, but there is no mention at attention on family members. So, we can eliminate B. So, right answer here is option C. Wasn't that simple? Let's look at one more. Here we have this question. What does this update tell medical professionals about bovine insulin? Update about this particular thing. Alright? Question? Okay. Let's look at the extract as well. About bovine insulin. The question says the options. Okay? Being withdrawn due to risks associated with long-term use. Users may experience difficulties switching to alternatives. When switching to alternatives. Any side effects more difficult identify in older patients. Okay. So let's find out what is the main idea being conveyed about bovine insulin here. So it's a memo to all staff and it says withdrawal of bovine insulin. So there is a mention of being withdrawn, But we have to understand whether there is any mention of being withdrawn due to risks associated. Bovine insulin preparations will shortly be withdrawn due to limited availability of active ingredient. So yes, it's being withdrawn, but the reason mentioned here is not because of risks associated, but because certain ingredients, active ingredients, are not anymore available. So option A is a contradiction. It does not say anything about long-term risks or association of it. So we can eliminate option A. As people with insulin-treated diabetes currently use bovine insulin preparations will continue to require insulin treatment. They will need to be changed to alternative acceptable preparations. So they need insulin treatment, but they will have to be changed to acceptable preparations, alternatives, other options other than bovine insulin. People using bovine insulins are likely to be older patients with long-standing diabetes. So do you remember this? They are older patients. They have long-standing difficulties, but difficult to identify. There is no mention of any difficulty in identifying. They are older patients with problems, but there is no mention of identifying or diagnosis being difficult. They may therefore have absolute insulin deficiency, which means we can easily eliminate option C. So in a way, we've already reached option B, but we need to confirm. These individuals will be at a risk of impaired awareness, predisposing them to severe hypoglycemia. Users may experience difficulties. They may have severe hypoglycemia when switching to alternative. So our answer here is option B. Now when you find the right answer, make sure you darken the bubble. Now the remaining part, you can just read it to confirm, have an extra confirmation. Use of bovine insulin associated with presence of insulin autoantibodies, which may impair the action of insulin. Human analog insulin is likely to lower the glucose and may be difficult. Insulin titration may be difficult. People with bovine insulin treated diabetes are therefore a high risk group. So this is extra information. Okay, this does not concern us. So we've already found out the right answer. So I hope you're now clear with the steps. Make sure you read the question, the stem clearly, underline the keywords, go through the answer options one by one, make a note of the key terms, then refer the extract. At any point you feel there's a word connected to the option that you've read, go back to the option, read the whole thing. You can either tick or eliminate it and zero in on the right answer option. So I hope today's video on OET Reading Part B was helpful, and I hope to learn from you how you found these tips. So please do not forget to try out these techniques and drop a comment as to how helpful this video was. Thank you.
Medcity International Academy. Trusted hands forever.